In today's session, we have Deputy Chief Dr. Pruitt, who's going to be with us talking about reopening for high schools. As we always mention to you guys, this session is going to be recorded so we can upload it to our YouTube channel and make sure that other folks who couldn't make it today are able to see it later on. We're also going to get started after our presentation with some of the questions that you guys already submitted through our RSVP, and know that the Q&A is open. So throughout the presentation, if a question pops up, make sure you write it in the Q&A, and then depending on the time, we'll try to get to those as well. Okay, thank you everybody for that. Next slide. And just as a reminder, we have 2 more sessions coming up. We have one with Chief Stokes for early childhood, and then we also have one with Executive Director for Student Assessment. So if you want to participate in those, check your email so we can send the RSVP links. And remember, if you have questions on those topics, put it in our form so that we have them ahead of time. Next slide. And like I said earlier, today's session is about high school reopening. So we're pretty excited, and today's speaker is Dr. Erick Pruitt. So here is his bio. I read it, you sent it to me, and I was like, whoa, you have been in education for a really long time, supporting our districts and other districts. So Dr. Pruitt, if you can tell us a little bit about yourself and just introduce yourself to our parents.
Absolutely. One, I just want to apologize to all the parents for having those technical difficulties. I ended up having to switch computers, but really happy to be here. I'm originally from Indianapolis, Indiana. I'm a Marine, spent 7 years in the Marine Corps, and had the opportunity to study at Purdue University and majored in elementary education. Right after the Marine Corps, I actually started my education career here in Chicago as a first grade teacher in the Woodlawn community. And so really excited to have been able to teach first graders and teach in elementary school. I've been a principal in Chicago, a deputy chief, and a chief, and I'm currently the deputy chief of high schools for Chicago Public Schools. Really happy to be here to review high school reopening. We have some really good news, hopefully, that I'll be able to share with you today, and look forward to answering your questions.
Yeah, thank you for that, Dr. Pruitt. I know you and your team put a presentation for us, so we're going to pull that up and we'll go through that. First, you can give us all this really good information you guys put together for us, and then we'll get started on some of the Q&A. So whenever you're ready.
Absolutely. And so again, thank you for allowing me to be here and share some information about high school reopening and a little bit about what that's going to look like moving forward. And so I want to thank everyone within the district and in the city who's been deeply involved in preparing for high school reopening. A year is a very long time to be physically away from school, and we're all eager to see our high school students back in the classroom for in-person learning next week. Next slide, please. So the Joint Task Force discussions have been very productive, and we announced earlier today that CPS and CTU reached a tentative agreement on high school reopening. The CTU's House of Delegates will be meeting today and will vote on the agreement. Our goal is to ensure students remain with their assigned teachers when they return to in-person learning. And we know that instructional models will vary between schools due to differences in enrollment and capacity for social distancing. CPS and CTU have identified a hybrid structure that will provide in-person instruction for all of our students that have opted in for in-person learning. Next slide. Our proposed framework seeks to balance high-quality instruction while ensuring we are able to offer students a safe learning environment. In order to accomplish this, we need to establish a few guardrails. First, we're going to preserve classroom schedules. Schools will determine the appropriate model based on the variables set in the framework, which are aligned to school enrollment, number of students opting in, and utilization rates. The framework will assess a school based off overall enrollment, how many students chose to return to school, and the school building's capacity to ensure students and staff can safely social distance. Next slide. School models school models will preserve student schedules and allow them to transition between classes. The opt-in survey data that was collected earlier in the year reflected that 36% of our families preferred in-person learning for quarter 4, while 46% of families preferred to continue with remote learning for the remainder of the year. Based on the variables identified in the schedule model framework, the majority of our schools will have students attending school 2 days a week in 2 different shifts, and the remaining high schools will have students on campus 4 days a week. Wednesdays will be a remote day for all students for the remainder of the school year. Next slide. Engaging students in this reopening process has been very important to the district. We formed a student strategic advisory team that has engaged their peers in reopening discussions, met with the principal reopening task force, provided feedback on the framework to reopen our high schools, discussed critical reopening topics important to them with district leadership, and made recommendations and presented those recommendations to our principal reopening task force. We developed and distributed a student-facing survey to hear directly from our students about how we can improve their remote learning experience or support them with returning to school. And we have and will continue to lead student focus groups to empower students to garner feedback from their peers. Next slide. So this time I'm going to talk a little bit about some of the social emotional supports that we have established and will be working on within our district. Next slide. The district is creating a sustainable and an effective multi-tiered system of social emotional learning and mental health support that enables schools to recognize students in need of additional services. One of our top priorities is supporting schools as they establish behavioral health teams, which is responsible for the oversight of a school's process for multi-tiered systems of support. One of the responsibilities of a behavioral health team is to ensure that students receive access to services that are responsive to their type and level of need. This includes training staff to recognize and refer students in need, engaging in student-centered conversations to understand. And so we are also supporting schools to ensure they have a broad menu of interventions available to students. Some students may benefit from an out-of-school time program, a peer or adult mentor, or small group intervention to address social skills development, substance use, feelings of grief, depression, or trauma that are impacting their daily lives. Some students may benefit from individual and or family counseling instead. Schools must be able to deliver or link students to such services. We've trained over 1,000 staff in addressing trauma, social skills, anger, and depression as part of the Healing Centered project. Next slide, please. To provide additional access to mental health services, the Healing Centered project is working to increase the number of partnerships between schools and community-based organizations. Currently, there are at least 232 schools that have a minimum of one social emotional learning or SEL mental health partnership agreement on record. This is nearly double the end of year total from the last school year. We also have 22 select partners who, since March of last year, have provided intensive mentoring and mental health services to students virtually. Presently, there are nearly 9,000 students receiving supports, and this number continues to grow. and does not include the number of students being served by other agencies who have been sponsored by schools to provide less intensive services. So we expect that the number of students being served is actually greater. Next slide. I'd like to share a little bit about vaccine distribution in our district since we've started. Next slide, please. As of March 17th, the district has offered vaccination opportunities to all CPS employees and employees of our largest vendors who work in schools every day. Our 4 CPS vaccination centers opened in February, and these sites allow us to provide up to 1,500 first dose vaccinations per week for staff. Over 8,500 employees have been vaccinated at CPS vaccination sites, and employees are also able to get vaccinated at their healthcare provider or other providers around the city. We strongly encourage staff to work with their healthcare providers or pharmacy to get vaccinated as soon as possible. We also launched a staff survey to collect information on vaccine status and sentiments to inform our planning efforts. We are making this data publicly available at cps.edu/vaccinations. I'll say that again, cps.edu/vaccinations. Next slide, please. The COVID-19 vaccines are currently approved for use in adults, which is why we have been focused on vaccination efforts for CPS staff. Clinical trials are now underway for the COVID-19 vaccine in younger people, so the district is getting ready to support student vaccination as FDA approval takes place. Additionally, we are working with CDPH and partner healthcare providers to help our older students, those who are 16 and older, to find vaccination opportunities. Finally, it is important that all students keep their and non-COVID-19 vaccinations up to date this spring and summer. This will ensure that when the COVID-19 vaccine becomes available, students will be able to receive it. Next slide. Our work to promote COVID-19 vaccination continues. We will create and share additional vaccination opportunities for CPS employees via CDPH and our health systems partners as more doses become available. We will also work with CDPH, public health experts, families, and communities to address COVID-19 vaccine hesitancy and build trust and excitement for everyone to get vaccinated. We will work with CDPH and partner providers to begin planning vaccinations for students who are 16 or older also. So this concludes my presentation, and I'm happy to answer questions that you may have.
Yeah, no, thank you for that, Dr. Pruitt. I think it's a lot of information, a lot of really good information. I know some of our parents, if I'm looking at the names that are joining us, have smaller munchkins, right, elementary school. So this might be a little bit different for those folks. So take a moment and kind of take a breath with all the information I gave you. Sarai, if you can stop sharing screen, that would be great. Thank you. So parents, the Q&A option is open. So if you have any questions on any of the stuff that was presented, feel free to jot it down. I am going to get started with some of the questions, as I mentioned earlier, Dr. Pruitt, of the parents submitted ahead of time. So we're going to get started with that. I have a question, and I'm sorry if I butcher people's names. I apologize ahead of time. From a community member, Tasha Smith from Illinois Action for Children. And the question is, when will school start?
April 19th. That's the short answer. However, it depends on, CTU will be meeting with their House of Delegates today, and we're hoping for a positive outcome.
Fantastic. Thank you so much. So mark your calendars, parents, for the 19th, and we will keep you posted with more information. Thank you for that. The next question that we have is from a parent, Lilia Guevara from Evergreen. And the question is, how is physical and social emotional education will be encouraged and implemented at the schools?
So I covered that a little bit in the presentation, but I really believe our Healing Centered project is working on providing services and supports not only for our school leaders and teachers, but more importantly for our students.
For sure.
And
No,
that support comes from our Office of Social and Emotional Learning.
for sure. And we did have some of them in one of our sessions, and they did talk a little bit about that. So parents, as we always talk about schools, right? Every school is a little bit different. So definitely call the school, talk to your admin, and see what's going on at your school so that you guys can know exactly what's happening at your specific school. So thank you for that. The next question we have is from a parent, Ofelia Gomez from Ruiz Elementary. She writes it in Spanish. So let me read it in Spanish and then I'll translate it. Los jóvenes van a tener que ponerse la vacuna para entrar a la escuela. So her question is, will the teens have to get vaccinated in order to attend school?
So again, the short answer is no. However, I'm going to lean on my colleague, Ms. Sontag, with regards to providing a little bit more information about vaccinations in teens. We encourage all of our families who are able to be vaccinated, and then when vaccinations become available for our younger people, we will be encouraging them to be vaccinated also. Allie, anything additional?
I will give Bernice a second to translate. I think the original question was asked in Spanish.
Yeah, there's an interpreter.
Oh,
so you're
perfect.
good.
That's right.
Yeah.
I forgot we're live interpreting. Perfect.
No worries.
So this is definitely complicated right now. The vaccine is only available, and one of the vaccines, just Pfizer, is available for students who are 16 years and older. Right now in Chicago, even if they're 16 and up, unless they have an underlying medical condition, they don't qualify for our current vaccines. That's going to be changing soon as we open up our vaccines literally next week in the city of Chicago to all people, regardless of their job type or their medical conditions, to get vaccinated. But if your child is 16 or up, they can only get the Pfizer vaccine right now. Moderna is 18 and up, and Johnson & Johnson is currently paused, but was 18 and up as well. So right now, there's a pretty limited group of students that could even qualify. In the next couple weeks, we expect to see Pfizer's request to the FDA get approved for children as young as 12. So they submitted that data last Friday, so about a week ago, to the FDA for review. Once the FDA looks at all of their data, there's three choices. One, the FDA says, this is really good data. I'm confident that it is safe for children all the way down to the age of 12. Option two is the FDA says, I don't think you have enough data. We want to be very sure before we approve anything. Go back and get more data, do more tests. And then option three is they say, I don't think it's safe. We're not going to approve it. It is very unlikely that it is that third option because they publicly released the data and it does look very, very good. So what is most likely to happen is in the next month or so, Pfizer will be approved, not just to 16, but all the way down to the age of 12. And then once again, right now, this is a vaccine that's called an emergency authorization. So this means that it's a specific type of FDA authorization. It's not a full normal process. The process is accelerated, but the data they have to submit is the same. And under emergency use authorization, you cannot require it of either our employees or our students at this point. Now, they will continue to submit more information. And so that emergency authorization may become a full authorization, and then we'll follow the direction of our public health experts on whether or not it's required. So today, no, it is not required to return to school. It is voluntary, and we do encourage that if you or your child qualifies to be vaccinated, that they do, because it offers protection for both themselves and the people around them that can't be vaccinated.
Thank you, Ali. That's a lot of really good information. So if your kiddos are 16 and up, hopefully in a week it'll be open for those folks to be able to get vaccinated. So that's great. I'm really excited with the news you gave us about the 12-year-olds because my munchkin is going to be 12 this week. So I'm excited that he can get vaccinated. So just keep, for the parents that are joining us, just keep looking at our site for information. I know the city's website also has a lot of information, so just keep checking those things for updates. As I know, as Ali has mentioned in other sessions, this information keeps updating, like every day something changes. So just keep abreast of that. Thank you, Ali. Thank you, Dr. Pruitt, for your answer. The next question that I have is from Jennifer from Jones. And the question is, do parents need to do anything about the Venture cards? And how will they be distributed to new high school students? You're on mute. I do that all the time.
So no, parents don't have to do anything different. All schools order the Venture card, through our internal system. They place that order. The cards are delivered to the school, and the school will distribute those cards to students.
Fantastic. So parents, again, that having that contact with your school would be amazing. So make that phone call or send out that email if you want more information. Thank you, Dr. Pruitt, for that. We have another question from another Jones parent, from Roberto, and it's a few questions. So bear with us, everybody, as we're going to go through these questions. The first one is about CTA, actually. How is CPS coordinating with CTA to protect students and minimize their exposure traveling to and from school using public transportation?
And so we're really fortunate to have that partnership with CTA. And so we have been meeting with CTA, one, to discuss what their safety protocols are on the train and bus. And CTA is following CDPH guidelines with regards to social distancing and mask wearing on the CTA. So they have their own set of protocols that they're following, and we'll be reinforcing that in our schools for our students to follow if they're using the CTA.
Fantastic. Thank you so much for that. His second question, a little bit about transportation as well, but kids who are riding bikes. So it says, is CPS providing or recommending schools to accommodate bicycle rooms or adding bike racks for students who prefer to ride their bikes to and from school to limit the exposure of using public transportation?
So we welcome students to use their bikes to get to school if they're able to do so safely. However, if a school is in need of a bike rack, I welcome the principal to reach out to its facilities representative and request a bike rack. We do have some in supply.
Fantastic. So reach out to your administrator, and if that's a need, then reach out to those departments. Thank you, Dr. Pruitt. The next question is, how is CPS monitoring each school's health and safety protocols once kiddos are back in the building?
So we have a daily health screener that all of our administrators, teachers, and students are required to submit prior to coming to the building. And also, once once staff and students do come to the building, temperature checks are taken. The health screeners verify that they were approved and are able to be in the building. And then, in case of a positive case, we do have care rooms where we can direct students to where parents will be able to come back and pick up their child from the school that may have had didn't pass the health screener. Also, again, in case of a positive case, the contact tracing team follows protocols to reach out to potential close contacts and provide guidance on who needs to quarantine.
Yeah, no, thank you for that. And I think just as a parent, my munchkin is going back to school as well. So I know I got the link to fill out every day. So make sure as parents, before the kiddos get to the building, to make sure every morning, right, before they leave the house, that is it's getting done, just to support us in the process. So thank you for that, Dr. Pruitt. The next question is about health. So is CPS offering insurance or covering medical expense if a student tests positive for COVID?
So the district does not provide health insurance to students. CPS is unique in that it supports all of our families who are uninsured or underinsured to enroll in Medicaid and SNAP benefits. This is support that has been offered pre-COVID through the Children and Family Benefits Unit and can be reached by calling the following number: 773-553 KIDS. I'll repeat it again: 773-553 KIDS.
Thank you, Dr. Pruitt. And I did put that information for anybody that's interested. I put it on the chat. There's a link to their website, CPS website in that department, and then the phone number. And again, don't rush to copy and paste. We will send this via email by tomorrow so that you have it. But I have worked with that team, and they're pretty amazing in supporting parents and when they have questions, so they need to apply. So if you guys are in need of that support, definitely give them a call, and that team is always there to help. And they do have folks who speak Spanish, so they're able to help you in Spanish if you need that support. Thank you for that, Dr. Pruitt. The next question that we have is CPS exploring vaccination sites for students only?
CPS is working with the Chicago Department of Public Health to develop plans to support student vaccinations as students in different age groups become eligible for vaccination.
Okay, fantastic. So as we get more information, and like we said earlier, and I know Allie talked about it, as things evolve, we'll have more information out for folks. So thank you for that. The next question that we have is from one of our own, CPS, CAD, and she's coming from Taft High School from the Culture and Climate team. And her question is, will counselors, social workers, deans, et cetera, will be able to meet in person with students one-on-one once they're back in the building?
So as long as social distancing is maintained, one-on-one meetings can occur per our district's pre-COVID protocols.
Fantastic, thank you. So teachers, counselors, I know we have a few joining us today, as long as we follow protocol, right? Or if we have questions, talk to our admin and they can contact our offices to make sure that we're following all the guidelines. So thank you for that. I'm gonna go through some of the questions that we have on the Q&A. So bear with me as I read some of them. So one of the questions is about fundraising events at school. How are they endorsed and approved with CPS now that we're trying to reopen schools so that it's done in a safe way?
So fundraising is approved by the school's LSC.
Yeah, so I think you didn't put your name, so anonymous, whoever answered that question, I think if you go through your local school council, or you can also go through our office, LSC Relations, and talk to the person, your facilitator, depending on what network your school is part of, or anybody really, you can talk to them, and then they can give you more specific details on how those things work and how they can get approved, or what can or cannot be approved for that type of event. And I think for part of your question, you were talking, Allie, you want to?
Sure. I was actually going to probably address that second half of the question. It was really about health and safety guidelines. So I know that historically, a lot of fundraising events are in person, are large gala styles, kind of follow into those social event categories, right? It's an easy way to raise money is by getting people together. And so we need to be following all of the guidelines that are put forth by the Chicago Department of Public Health for any type of in-person gatherings. So there are specific guidelines for both social events as well as ticketed events that are available through the Chicago Department of Public Health. Any events that are held on school property or related to school need to strictly adhere to those guidelines as they are a reflection of where we are as a city and what the Chicago Department of Public Health deems a safe group to gather.
Fantastic. Thank you. No, thank you for clarifying that at everything that we do, we have to follow guidelines and protocols to make sure that not only the kids, the staff, but whoever's participating, right, stays safe in whatever environment they're in. So thank you for that. And Allie, maybe you
And
can
Bernice,
also, yeah, go ahead, Dr. Pruitt.
the first part of the parents' question around building trust and confidence, that's been a theme as far as feedback that we've heard from principals, that we've heard from parents, that we've heard from our own students. And so we definitely recognize that as we begin to reintegrate ourselves back into in-person learning and being on campus, we've been out of school for over a year. And so having some systems in place to build trust, not only between our staff and students, but between our school staff and parents is really going to be important as we move into Q4, welcoming our high school students back. Then also as we look to potential summer programs for high school students, and then also looking to the fall and what that might look like for us.
Yeah, no, definitely. And Allie, maybe you can address, there's like a couple of parts to this question, right? One of them is talking about requiring vaccination, right? So you touched a little bit about it, of why it's not required. Can you refresh our memory a little bit about the requirements for vaccination?
Yeah, so at this point, because this vaccine is authorized under the emergency use authorization from the FDA, there are specific rules about what we can mandate. So we'll be following the directions of the Chicago Department of Public Health, of the Illinois Department of Public Health, of ISB. But at this point, we can't require a vaccine that is authorized under this emergency use authorization. This may be revisited if the authorization changes, and depending on what our public health experts advise us.
Yeah, no, thank you, Alec, for that. So it's important, right, to know that difference, right? Because I think a lot of us as parents think, well, my kid needs this vaccination, and if not, they can't go to school. So we're kind of like putting them together. So I think making that difference and really you teaching us, right, the difference on that really makes a lot of sense. So thank you, Ali, for that. I don't know what the next one is. I don't know if you guys know what it is. It says, is it a CPS, CHS? I don't know. If that was
I think the parent was just notifying us that they were
from
they wanted to
that
be
school.
cautious about identifying who they were.
I see. Okay. I was like, I don't know what that means, guys. Sorry. Fantastic. Again, we have the Q&A open. So if there's any parents who have any questions, we have the experts now to tell us. So as I wait for some folks to put a couple more questions on the Q&A, I did put some links in the chat that were provided to us by Dr. Pruitt and his team, and by Allie and her team, about different information that might be interest to you guys, right? We have about sports, in-person learning, social emotional learning, the online reopening guide, if you guys want to take some time and read that, end of the year activities, stuff for grade 9 to 12, in-person school day example, if you guys want to know what that looks like, there's information there. Providing safe and clean learning environment, so there's a lot of information there. And also for the learning hubs that we do have available throughout the city. So all those links are there. Don't worry about copying and pasting. If you're in a rush, we'll send those out to you guys as well. So
Bernice, I think it's also important for the parents on the call to make sure they know one, what model their school is operating under, and if it's model 1, their child will be going to school 4 days a week, with Wednesdays being remote. If their school is a model 2 school, it's really important that parents know which shift their child has been assigned. And so what I mean by that, if we have a school where we've had 1,000 students opt in for in-person learning, and that school is in model 2, what happens is the school will then divide that 1,000 in half. 500 students will be assigned to come to school on Monday and Tuesday, shift A. The other 500 students would be assigned to attend school on Thursday and Friday, shift be. And so it's really important that parents, if you haven't not been notified yet, that you reach out to one of the administrators at your child's school to ensure that you know which day they should be reporting to school.
Yeah, no, that's definitely really important. We don't want to show up on the wrong day. So make sure you guys have received that email. If not, like Dr. Pruitt said, make sure you call the school or send out an email to the administrator to make sure you guys have received. I know I don't have a high schooler, my kid's a munchkin still, but I know his school just sent me that information to be ready for fourth quarter. So make sure that you guys receive that. I don't see any more questions on the chat from parents. So what I want to do, Dr. Pruitt and Allie, really from all the information you guys provided, it was a lot, right, to take in, a lot of really good information. From everything that we learned from you guys today, what are the 3 key takeaways that you want our families to take from the session this afternoon?
I think it's really important for parents as we gear up for our students coming back next week. One, I think I just mentioned one. Make sure you know what your child's schedule is, if they've opted in for in-person learning, and if they aren't attending school 4 days a week, um, understand which shift they've been assigned. If your child is receiving transportation, make sure that you have that information with regards to transportation. And then also, all parents that had students opt in today should have received a test text from the district around the health screener, letting you know that this is the type of text that you'll receive to complete the health screener once we start school. So please, if you're not familiar with the health screener, please, I think we included information about the health screener in the links. If that doesn't help, please reach out to your school principal or AP to get additional information. The other thing that I want parents to know is that in building this framework, in our collaboration with CTU, with building the framework, the safety of our teachers, our school leaders, and students was the priority. And we also understood that how we begin the fourth quarter really sets us up for how we look to bring students back in the fall. Allie?
Fantastic. Thank you, Dr. Pruitt. Allie, is there any takeaways that you want our parents to take from all the really good information you provided today?
Sure. I guess just on the vaccine front, is that's the thing that I talked the most about, is that there is a lot of information out there on vaccines, and there's a lot of misinformation out there about vaccines. So take the time to, use well-validated sources. We want you to be well informed about decisions for yourself and your family. But make sure that you're using quality resources. CDC has a ton of information. The Chicago Department of Public Health has a ton of information, but also go talk to your primary care provider. It's really important. They know you and your child best. So if you do have questions, I don't know, what about this? Those are your primary care provider is going to be able to give you the most personalized health information. So I just encourage all of us, in all things COVID aside, to be well informed, to be good health consumers, and make sure that we're using quality information to make decisions. Because in the end, that's what matters, is that we have the information in front of us. So we're happy to support in any way that we can. But in the end, I want to make sure that you're getting your questions answered.
Fantastic. Thank you, Ellie, for that. I think that's really important, right? A lot of, I know our communities, I know my mom says like, well, I talked to your aunt and she told me this. And I'm like, Mom, let's talk to your doctor, or let's look it up here, on the internet for the CDC. So it's really important, right? That you do have that communication with family and share that information, but also go to the source and make sure that it's accurate information. So thank you for that, Allie. We have one more question before we close out, and Ricardo put it up on the Q&A, so I don't want to miss his question. And the question is, what action, and you talked a little bit about this already, Dr. Pruitt, but what actions is CPS taking to help kids emotionally? Some are facing difficult times and one counselor is not enough for all students.
No, absolutely right. And so again, with the services that our Office of Social and Emotional Learning are providing, the creation of the Healing Centered project, ensuring that all of our campuses have behavioral health teams. We take the mental health of our students very seriously, and the Office of Social and Emotional Learning is working very diligently to provide resources, training, and supports to our schools as we welcome students back, and then looking to the summer and going into next year.
Yeah, no, thank you for that, Pruitt. So there's a lot to come. I put a lot of, Ricardo, there's a link on the website talking about social emotional support. So I encourage you to click on that and get that information. We'll email it too, since everybody who's here today registered and we have your email. We'll send out the deck that Dr. Pruitt presented today, and then all the links that we share with you guys. So you will have it over email by tomorrow, so that you can look at it, take some time to read all the awesome information we have. And if you have questions, there's some phone numbers there that you guys can also reach out. But call your school, right, as well, if you have this information, to see what things are being put in place for specific schools. As we mentioned, I think in every session, right, every school is different. They have different partners, different things like that. So make sure that you contact your school and have some of that information. So with that was the last question we had there. I want to thank everybody for joining us this beautiful day outside. It was really sunny. So thank you everybody for taking that time and really joining us this afternoon to share this really great information. Dr. Pruitt and Allie, thank you so much for your expertise and coming on board and sharing this really important information with us. Really appreciate you guys coming on board.
Thank you.
Yep. And with that, everybody have a great night. We'll see you next week at our next session if you want to join us. Thank you, everybody. Have a good one.